I hear
Hey everyone, let's go ahead and get started. My name is Dr. Melinda Rodriguez, physical therapist. I am here to be beautiful inside and out, and also to be wealthy. Is that what it is?
yes.
Health and beauty. So, without further ado, I'd like to introduce Dr. Hoan Pho, the man of the hour, to do some welcome remarks.
Well, I don't know if I'm the man of the hour. Thank you, everybody, for coming tonight. So we're just going to have a presentation, just kind of learn about what the meaning of health is. Health, beauty, and health may be more than just physical health. It may be also, Anthony, am I standing in the right place? We got the YouTube thing? Okay, this is live on YouTube. So if you want to volunteer to ask questions and things like that, we'll focus on you. So I am an internal medicine doctor. Been in practice about 28 years. This is our 29th year. And I want to talk to you about how to try to achieve the best health and the definition of health. And then we also have very talented people here today that's going to speak to you about other parts of health and also about wealth. So we have our introducing person is Melinda. She's amazing. So Melinda is actually on the board of University Hospital, and she's had numerous awards, service of for medical treatments and physical therapy. She has a doctorate in Boston University at physical therapy. So hand of applause for Melinda. She'll introduce us all. We have Dr. Mulroy, Amy Mulroy. She's a psychiatrist. So she's going to talk to you about mental health and spiritual health. And that's also what's important. And then we have Gretchen. She's representing Peterson Chiropractic Clinic. And she's going to talk to you about how to relieve pain naturally. Okay, that's wonderful. And then since we're going to help you live for a long, long time with great cognition, great health, you better have some money saved up. So we have, he's actually the man of the hour. Zui got me involved in this. Back there, he's going to talk about financial health because you're going to need your money because you're going to live for a long time and doing well. All right, so without further discussion, I want to talk about health and wealth. That's it. I guess I can advance the slides somehow. Probably had it somewhere. Being absent-minded, I left it. Okay. All right. Yes, we said thank yous to everybody, but to be honest, the real people I need to thank is everybody that made it here. I know it's busy and you came to listen. And I'm glad you did, I appreciate it. But we're actually going to give you the real secrets to longevity, health, and financial security. But I've been doing this for a long time. And I want to give you, I teach medical students and nursing students, and I tell them, I want to give you the pearls. The pearls means you have to spend years and years in searching for an oyster that has a pearl. I'm actually going to get that pearl and put it on a plate and give it to you and serve it to you. So that's what I'm going to do today. I'm going to give you the secrets. Thank you for coming. So early detection is key. So come see your doctor, get a checkup. But the problem is in healthcare today, most physicians are too busy. Okay, you have these big conglomerate of medical care institutions that are not looking to prevent your problems. They're waiting for you to complain about something. And if you don't complain, you will have 5 minutes with them, and it's done. So routine screening is very key, and I like to pride ourselves, and if you come see us, thank you, we're going to give you a personalized care plan. And no, we don't need to charge you concierge prices that they don't do anything anyways. So, our treatment plans are going to be based on nutrition, exercise. There's an acronym, and it's not on this slide, but the acronym is NEURO. So the acronym NEURO, neuro, is to prevent dementia. Okay, so N is for nutrition. Okay, E is for exercise. I'll cover this. I mean, I can talk forever. There's a lot. I mean, nutrition. I can give an hour talk on nutrition. Exercise. We can talk about for an hour. Mental health, social support. If you're going to have to take medications, it should be precise. We have to worry about side effects. And then I think what's really key is if you have a doctor that you have a relationship with, that you see kind of regularly, they'll know you, they have your records, and they'll know what's going to happen or may not happen. All right, so a little, kind of foreshadowing of other lectures to come. Good health. What is good health? Okay. Dr. Rodriguez, put you on the spot. She's jet lagged, she just came from Philippines. What is good health? What would you define as good health?
Good health for me is very holistic. It's not just physical, but there's the mental state, the emotional, and like what I said, beauty inside and out. So, and then also it's the preventive, right? We live in a society right now that is disease care. I think the way to go is healthcare, which Dr. Pho is my doctor too. So thank you for doing that.
Thank you for that. So that's absolutely right. So good health doesn't mean just that you do not have disease, okay? I think it actually means happiness. So I'll share you with my journey. I look great, right? Fit, triathlons, all this business. And I might not have good health because maybe I'm too stressed. I'm actually not. No. Maybe my nervous system is too wired up, and that's not good. Maybe I do not have a good environment, social network that makes me happy. So that's not just important to be healthy physically. It's also important to be healthy mentally, socially. Happiness. So, okay, a lot of your health problems is genetics. You can't change that. Okay, if you walk out of here today, I want you to learn, number one, your health, what happens to you, has been predetermined by genetics, by the Almighty God, Jesus Christ. Too late. You can't change that. You didn't pick out your parents right. I always tell my patients that, and it takes them about 3 seconds. You didn't pick out your parents right. Dr. Amy has perfect parents. Look at her. Perfect. And you can't pick out your parents. So you have genes that are going to express themselves. Genes that, now I'm going to say something here. You should listen. The genes don't mean you're going to get cancer. There are genes, like for breast cancer genes, there are mutations that if you have a higher propensity of getting breast cancer. But it doesn't mean you're going to get it, okay? And you can't change anything about that. But it's good to know that. So if you look at your parents, and they have a heart attack, they have heart disease, and they have diabetes, and they have cholesterol, okay, you might have it. So you better behave. That's it. I talked about this slide. I'm going to tell you something. We do genetic testing in our office. Okay, you can do it on your own. There's 23andMe. It detects risk for a bunch of cancers, blood clots, all sorts of stuff. You can mail that in. In our office, we do a test called Gallery. It detects the genes, the cancer cells in your body. So if you have some money, this is not covered by Medicare. You spend about, in our office, we have a good discount. It's through Gallery. So $750. It detects 40 different types of cancer at stage 0. Meaning, if you're a VIP type people and you want to spend $750 per year, you can detect early cancer of 40 different types of cancer. Some of them will kill you, like pancreatic cancer. This is a wonderful test. It detects cells, cancer cells in your body in the bloodstream. It could save your life. We do the test for hemochromatosis. Dr. Moro is going to talk about the gene for MTHFR. That's a mutation that causes all sorts of problems with your brain, your emotions. And ApoE4 is a gene that you don't want to have. If you have that gene, you have 7-fold increase of Alzheimer's disease and heart attacks. So I don't know. I talk to patients. I'm like, do you really want to know? I don't know. I think if you talk to Dr. Moro and you're calm about it and you don't have total anxiety and you can deal with it, you might want to know because you should probably, be careful, right? All right. Goodness. So, Dr. Moro and I love to cook. This is some of our pictures of our food. Let's see, I guess there's oh goodness. Boy, I really, okay, that just tells me like I'm running behind. So this is like turmeric, garlic, curcumin, ginger, lime, all this stuff. This is all good for you, okay? This stuff has antioxidants. And, what here this slide's talking about is epigenetics. Epigenetics is, okay, you have your genes. And then what you can do to modify your risk with what you do with your lifestyle, okay? So we're talking about, nutrition, exercise, mental, spiritual health, social. Sleep, I'm just going to touch on this briefly. Sleep is very important. So sleep is very important. This is a time when actually you build memory. And she's going to touch on that a little bit. And this is when your brain lymphatic system actually takes out all the toxins in your brain. People who do not sleep well will have poor memory. And how do I know this? Well, Dr. Moro is very smart. She would study ahead of time. In medical school, we were medical students together. And she would learn everything. And I might be lazy. And I would cram for stuff like 2 or 3 days before. And I didn't get enough sleep before the night of the test. And I would remember for the test, but after the test, the memory was not built. So you need that deep, deep sleep. It's very important. So whatever it takes. Now, I don't always advise medications, but it may be something in your life that's preventing you from getting good sleep. Okay, we talked about this already. Physical exams, blood tests, genetic testing, cancer detection, vascular studies. We had a demonstration on a vascular study down below. So I'm a big fan of this. One of the reasons you want to get a vascular ultrasound of your carotids and also a calcium score of your heart is it'll detect any blockage or plaque in your arteries that will lead to a heart attack and stroke. They're a very simple test. And if you have plaque and clogged arteries, you better lower your cholesterol, diabetes, hypertension, all of those things. Let's speed up so we can have questions and answers. Okay. Now, this is 1 live to 100. Mr. Owen. Mr. Owen's one of my patients. Mr. Owen is 95 years old. Wow. Mr. Owen has been my patient for 29 years. Mr. Owen tells me, I asked him, why is it, he's an inventor, he has a bunch of patents. And how come he's so sharp and does so well? And he said, you exercise every day, right?
Yeah.
Tell us what you do in the morning every day.
Well, I have a treadmill and a stationary bike, and I alternate day by day each one for about 30 minutes. And then when I'm on the bike, I have 2 5-pound
Weights.
dumbbells, and I use them while I ride the bike.
Thank you very much. Now, how many of you did that this morning? Okay. Exercise. So exercise is one of the things you can do to prevent dementia, Alzheimer's disease. It's been proven, they've done studies, and it makes sense because it brings blood flow to your brain. It also detoxifies you. It's all good. We're meant to be running around from dinosaurs, and we stop because we drive to McDonald's. So, I don't treat diabetes anymore. I don't treat cholesterol anymore. I'm an internal medicine doctor. I don't treat joint pain. I don't treat high cholesterol. I don't want to treat any of that because there's a lot of ologists out there, specialists, cardiologists, endocrinologists, treats diabetes, gastroenterologists, inflammatory bowel, all of these specialists. You know what? I can eliminate all of them. They hate me. You know why? I treat weight. You lose weight, you don't have diabetes. You lose weight, your niece will feel better. You lose weight, you'll be happier. You lose weight, you get to spend money and shop, get new clothes. Right? You lose weight, you don't have heart disease. You lose weight, you don't get divorced. No, just kidding. You lose weight, you're going to want our aesthetic treatments, and we're going to talk about my special erectile dysfunction, ED, sexual treatment, Alma Duo, coming up. And then you're going to want all sorts of things. But you lose weight, I'm kidding, I'm not kidding. You're not going to have any disease. The other thing that's kind of cool is, I've done a lot of study on this, is inflammation. Inflammation now is called inflammaging. Inflammaging. Inflammation causes aging. Look at Mr. Owen. He's about to be 100 years old.
Wow.
And inflammation is caused every day by your environment. The most important cause is food. If you eat foods that inflame you, like sugar, saturated fats, animal products, it's going to inflame you. You want to eat plants. Plants have products that reduces inflammation. They're anti-inflammatory. They're antioxidants. They come from the ground. They can't be that bad, right? That's what we're supposed to eat. We're supposed to eat plants. They are anti-inflammatory. You can take stuff that's anti-inflammatory. I'm taking up too much time. The chiropractor people are going to talk to you more about it. But you guys buy some curcumin. Well, you buy it as turmeric, which is a root. Matao is our physical therapist. It's her physical. She's back there. She's from India. Turmeric is an ancient root, like ginger. It has properties that stop inflammation, helps your joints, helps your skin. Thousands of studies that help prevent cancer. Yes, it's from India. I have a lot of Indian friends. They're all doctors. They're all doing great. They're crazy. You guys are crazy. So they're like, God, when I got sick, my grandmother said, here's some turmeric. Go, burn it up and, smell it. You'll get better. But it works. Turmeric works. Anti-inflammation. Okay, we got to get going. Blue zone, anybody know about the blue zone? So blue zone, this is where people live to 100. They're running around, doing Tai Chi, doing all sorts of stuff. There's about 7 blue zones. Check it out on Netflix. Netflix, the Blue Zone. Blue Zone, they do plant-based diet, movement, social networks, stress reduction. Look at this. I talked about nutrition. I talked about exercise. But what's important is your interaction with your peers and other people. These people live together and they work together. We have a problem of this in America. Okay, we don't live together. We don't socialize. We have here Loma Linda, California, Costa Rica. Damn, that's a nice place. And then Sardinia, Italians, Greece. Oh, this is Mary. Mary Crabtree's my patient of many years. She's from Greece.
I'm 102, by the way.
She's a goddess. She's a goddess from Greece. We have the legend. And I'm the king. All right, we have Japan. Those damn Japanese, they live forever. So if you guys, okay, I'm going to give you what we call pearls, right? I'm keeping my time here. I'm sorry, I can talk forever. So Okinawa, Japan, there is a sweet potato. It's a purple sweet potato. It has all these nutrients in there that are antioxidants, anti-inflammatory. These people eat sweet potatoes 3 times a day, and they move, and they're not obese, but it has it's a lot of fiber. A lot of fiber. You go to the store, it's the purple sweet potato from Japan, Okinawa. This is the diet that you should eat. I don't care what disease you have. I don't care if you have diabetes, girlfriend or boyfriend. I don't care if you are fat, skinny. I don't care if you have a heart attack. I don't care if you have cancer. This is the diet you need. I'm going to make it simple. I don't mean to mess around. I've done it for a long time. Blue zones, Mediterranean diet. I'm going to tell you, we have different ethnicities in here. We don't really eat this. My parents are here? No. When I come to their house, and I talk about this, but then they start serving me like rice cakes. Well, it doesn't really fit in here, okay? So on the pyramid, which means what you want to do here, you want to exercise. We got all this exercise stuff. Enjoy daily. Daily means grains, vegetables, olive oil. Weekly, some meats. Chicken and fish. Chicken, very rare. Cheeses, and then, your sweet stuff. I like this. Thank you, Anthony. Herbs. We talked about cinnamon, paprika, ginger. Ginger's great. Sickness, rosemary, oregano, garlic, turmeric. Eliminates cancer cell from the body. Garlic helps infections. There's going to be a rush to the grocery stores. We're going to have a panic here. Not toilet paper, but turmeric. Hormone. We're getting to the end. I love it if you're at a time when you don't have a lot of hormones. It can cause a lot of problems with weight gain, mood, quality of life issues. I'm a big fan of hormones. We replace hormones safely in our clinic. I want to talk about this hormone. This is very interesting, okay? And it leads to our treatments and aesthetics. So a lot of what I talked about is for great health is physical. You're talking about good nutrition and exercise. But really, when you think about great health and like feeling good about yourself, it's about happiness. And I think, having a good partner, I think people who have pets, who have a good partner, who have a good social network and friends actually do better in life. And there has been studies on this hormone that's called oxytocin. So oxytocin is really the love hormone. So, you know, you're in love, you have a nice date, and you're dating and things like that. The levels can go up. You're having interactions with your friends and meetings and dinners. That hormone goes up. But it's interesting that, and they've done studies on this. I'm not kidding. So there are actually bacteria in your gut that stimulates your brain in a particular area that, like Dr. Moro is a specialist in, the hypothalamus that produces oxytocin. And oxytocin helps you feel good, helps you feel warm. It's like you pet your dog and you feel this warm, fuzzy feeling and you're happy. It's your oxytocin that's released. And it's weird. So they did this study in rats. Okay, you can't do this in humans. And they did it on wound healing. So the rats, they gave them a wound, and they fed them this bacteria, Bacillus reuteri. Y'all could Google check me. But that bacteria, which is created in your gut, and if you have bad gut, if you eat poor nutrition, you're not going to have this bacteria. But this bacteria stimulates your hypothalamus to actually produce more oxytocin. And they measure the oxytocin in the rat, and they measure how fast their wound would heal. And the rats that got the bacteria wound, their wound healing was a lot better. So it's crazy. So you can imagine wound healing, cancer, healing of your body. So it's true. If you're happy, you're in love, you have a good social network. Well, some of us can't do this, but if you have a baby and you breastfeed, that's, you know, oxytocin is stimulated, and you have all this wonderful experience. Okay? So I don't know how to try to tie this in there. I'm going to make it kind of funny, but I do aesthetics now, and part of what I do, since everybody's living longer, doing a lot of things, I have a treatment for sexual dysfunction, for erectile dysfunction in men and women. And we have therapies where we break up plaques, help circulation, and yes, help you improve oxytocin. And we can talk about that if you're interested. All right, we're getting to medical aesthetics. And I'm going to have my sponsor speak a little bit if they want to. And we have things that help your pigment, wrinkles, laxity, melasma. I have all this stuff. We have the best laser stuff to make you look great. I'm always into great new technologies. We can remove your hair when you don't want it for the bikinis in the summer. And guys, like Mr. Zvi, the legend there, he's got the great hair. We're responsible for his hair growth. We can grow hair where you want it. And we can remove it where you don't want it. It's one stop. We have this wonderful machine. It's wonderful, it removes pigment. You have melasma, pigmentations. It's wonderful. We have resurfacing. This targets water, ablates your skin, 5 days of downtime, redness, removes all your lines and wrinkles. It's wonderful. It's very, it just gives you a new boost. Your skin will look amazing after 3 treatments. All right, and we have, this is amazing, the Alba Opus. I can talk about this. And it basically resurfaces your skin. Very low downtime, not like CO2. Stimulates collagen, wonderful youthful texture. That's the dual machine. It's a shockwave, non-painful, and we can restore sexual health and wellness. Okay, you have a little video.
My name is Dr. Hoan Pho. I am an internal medicine physician, and I specialize in adult patients with complex multiple medical problems such as diabetes, hypertension, and cholesterol. Because the patients actually are asking for it, and also I like to help patients feel better about the way they look. Some of them have had damaged skin that they're not proud of and they're unhappy about the way they look. It really helps their confidence when we're able to help them look even better. Opus is a wonderful machine that we use fractionated plasma technology, not a laser, and it's ablative, but it's fractionated, so you don't get a lot of downtime like a CO2, but you get great resurfacing. And the nice thing about that I really like about the Opus is that since it's not a laser, you can really treat around the eye. You can do kind of like a blepharoplasty with a tip, a Kalibi tip that you can lift the eyelids and help the under eye bags. Also, one of the most difficult things to do in aesthetics is lifting and tightening. And with our RF that's included in the Opus, you can do tightening and lifting. So I think it's a very versatile, very safe for all skin types. And it actually also helps lines, wrinkles, and also pigmentation. So I love the Opus. It's one of the workhorses in our clinic. We have the Dual. This lends itself well in my practice, since I do internal medicine. We have a lot of patients with diabetes, high cholesterol, high blood pressure, and it leads to erectile dysfunction.
Okay.
And the mechanism is basically plaque buildup in the arteries leading to the genitals. And the platform here uses shockwave treatment of men and women with erectile dysfunction. It's the only machine that is FDA cleared. No pain, there's no need for numbing. 6 treatments, twice a week for 3 weeks, and it's very effective. We've had tremendous success, very high rate of success with this machine for internists and family doctors out there. Your patients are needing sildenafil, Viagra, tadalafil. That's telling you that probably their erectile dysfunction is from vascular disease. So this would be very good to treat them and prevent further worsening of their problem. So I've been very happy with that. It was not too difficult for me because I've been in practice and I have a big patient population. I think what has helped.
Okay. So the next time we'll have a networking like this, we're gonna have Indian food. Because like what Dr. Pho said, curry is good. Anyways, also, I do have a t-shirt that says, exercise, not extra rice. I'm Filipino, so we eat a lot of rice, like, you know. So everybody knows Dr. Pho, but Dr. Pho is a wonderful doctor. What he's doing right now is innovative medicine. So it is not just a traditional primary care physician internal medicine. And it's also showing that if you look good, you will feel good, right? So that's what he's trying to do. He's from Vietnam, Saigon, 1994, UT Health Science Center, UT Health Science School of Medicine, and
well, you're aging me now.
35. Sorry, because it's evidence-based, right? So there's history, there's also evidence-based, valedictorian, Robert D. Lee, and then Trinity University, Biochem, can you say that? And then magna cum laude, right, for the school, for the medical school. And he does have a classmate here, UT Health Science School of Medicine. It's Dr. Amy Mulroy. An Aggie to start, like my daughter, for her pre-med, which is Bachelor of Science in microbiology, and then back here in San Antonio for medical school. So psychiatry, done everything from academia to research to now private practice. So that's our next segment. You all have any questions for Dr. Pho for his presentation?
Please. Talk to me later.
Okay. All right.
You have my number. Call me later.
There you go. So next speaker for tonight is Dr. Amy Mulroy. Let's give her a hand.
First of all, Dr. Amy Mulroy, and I'm very thankful to be here and to be added slightly last minute to add to a health approach to well-being, because that's what Dr. Pho does. He wants you to live your best life. And we have lots of conversations about the different kinds of ways we try to help patients live their best life. And need to be here. Okay. So I put together a very short slide presentation just to give you an idea about what I do. So over the years, 30 years in practice, being a psychiatrist, I've run the gamut of trying to help people to feel better about themselves in their emotions. And I've come full circle to really trying to treat people in a holistic approach. You know, it is important to assess how your body is doing, what you're thinking about, how your mind is doing, how your brain is working, and then of course your presence in the world, your spiritual being, and how you balance that. So that's my general overview. Okay, so just to play on words here, like what is well-being and what is being well. And so I have a way of trying to help my patients be actionable in their life. And the very first thing they need is the ability to be truthful with themselves. Okay, and so many people come in and they struggle. You know, they struggle with things that make them feel bad. You can feel bad in many kinds of ways. You can feel bad sad, bad mad, bad anxious, bad confused, bad angry, bad poor concentration, just bad. And so I really like to help people give actionable steps, not just throw a medicine at them and have them come back. That is not helpful. You know, and so the primary action step is to, one, be able to become truthful with yourself about what is going on in your life, and not pointing the finger at the other people in your life, but really pointing the finger at yourself and what you can do. And so in my opinion, I think people need two things, and that is it. The ability to be truthful with yourself, and then the ability to act on that truth. If you do it over and over and over again, you will learn more about yourself. You will become insightful, you know, and be able to make changes that you need to make to have a better life and to feel better. And then if you are doing truth and action over and over, and you have insight about yourself, you're growing in how you understand yourself, and sometimes that's in help in therapy when you're talking through difficult things, you all of a sudden arrive at a place of integrity. And I'm not talking about moral integrity, although that might be part of it, but more about wholeness and completeness. You no longer feel broken. So people come to see the psychiatrist, they don't like to talk about it because they feel broken. And my goal is to help people not to feel ashamed of the brokenness that they've had from living a life, but to have peace about it, and then to live in a more healthy way. Okay, so well-being, what is that? Dr. Pho already addressed that it's really being in a state of good health. And he, you know, he said it's diet, nutrition, and exercise, and it really is. But in my way of thinking, and as a holistic psychiatrist, I try to treat my patients in a body, mind, spirit approach. And so it's physical health, it's mental health, what you think about, it's how your brain is, and then it's spiritual health. So, let's see, okay. Being well. Okay, these are actionable things, right? So our well-being, having full body, mind, spirit approach, good physical, mental, and spiritual health, leads us to live our best life, right? It's fairly simple. And what does that mean? We're productive. We're productive at work, in our relationships. When negative things come along, we can handle them with ease, not dis-ease, but ease. And basically a feeling of satisfaction that lasts. So Dr. Pho said to be happy, which I think is happiness is a very short thing, but joy and satisfaction is long and it's enduring. So even though something negative may happen, the well-being that I have within can emanate outward to deal with the difficulty that arises. And, that's what we're all looking for, is to feel satisfied with our lives. Okay, so I like to explain when my patients come in about the actionable things that they can do to understand, okay, you're here, you're being treated for depression, anxiety, bipolar disorder, whatever the typical things that a psychiatrist will see is like, well, what moves you? What motivates you, right? This is brain, heart. And people in general are not aware of what moves them. So like the brain has many internal drives. A very clear example is we have a drive for food or hunger. And that keeps us alive, right? We have a drive for thirst. We must have water for every cell of our body to work. But there are other things, right? Like I happen to be a very curious person. I love to learn. So, and that's fun, but it starts as babies and as children, right? What do? They explore the environment. They learn to throw a ball. They learn to play the piano or the clarinet or the guitar. They do some form of art. And that's about being able to be present in the world and have to like the world and to participate in it. And everybody's different, and it takes a lifetime to learn, what are you good at? What do you like? So one of our internal drives is to, very simply put, to have fun. Notice these are all F's, so you can remember them. Okay, food, fun, okay,
There's
family
one-
and friends.
Is there one missing down
There
there?
might be.
There's the dual machine for you know
Well,
what.
there might be a couple.
Don't try the F word there.
Okay, so family and friends, right? Like I treat people who have broken relationships, right? They are not happy with their family or their friends. They feel disconnected. And so really a internal drive is for connection, is for love. And he mentioned oxytocin and the duo machine, because there's another F that's not a acronym.
My patient says it all the time. I don't want it.
And of course, fear. Why is that up there? Okay. A fear, there's a part of the brain, the amygdala. It's really the attention center. But when it is overstimulated over and over and over and over, people become very afraid. And you get many responses. But in general, you can freeze, right? And not do anything. People that have had repeated trauma, they're often frozen in reactions to other people. You can flee or run away. So how an adult human flees is they stop talking, or they go to their room, or they don't interact with people, right? They no longer go to their workout class. They are quiet at work because we flee to the into our mind, right? And fight. So anger is a response, or physical fighting, cursing, slamming doors, fist fights. sometimes people avoid these problems associated with fear by doing other things to manage it, but those things that they do to manage it hurt them. And so the biggest example is alcohol, right? But you can easily sum it up into anything that is excess that makes you feel good. So sex, drugs, and rock and roll in excess will cause a problem. And, and so when you come to the psychiatrist, I'm gentle about getting people to talk about what are your fears. Okay, and then faith. So what motivates you? So many people, they want to know that they have purpose and meaning in life. And so sometimes this is absolutely directly related to your relationship with a power, like a vertical power, something bigger than you. Because when that's established and firm, then you can have good horizontal relationships between people. And so it's important to, assess, well, what are your beliefs, right? Like, I'm not asking about, do you believe in big G-O-D, but that's good. But sometimes it's just, what do you believe, right? Do I believe in goodness? Well, if you do, then go be good, right? And do you believe in nature? Well, get out and take a walk. So thinking about what moves you. All right. So disorders of these drives or disorders of motivation. If we go back to food, I treat people who overeat. They might have obesity, or bulimia, or anorexia, right? Which is like just the complete opposite. A desire that, or a fear that they're going to be overweight, so they do not eat. And they get very underweight. And of course, if you're underweight, you're going to have problems with all parts of your body. And, people die because their electrolytes get too low and they have a heart attack. So it's not good. And that's usually, in my experience, in very young people. Okay, disorders of fun. Okay, sex, drugs, and rock and roll, addictions, workaholism. Okay, so like I said, I'm a very curious person. I like to read, I like to study a lot, but sometimes I can do that to the exclusion of getting home early enough to have a nice meal. So, being able to recognize when you're doing something too much because maybe you're avoiding something else in your life. Disorders between family and friends. Okay, I see this all the time, right? Like, it is very important to have good boundaries between people, between yourself and others, because the only thing that you can affect a change in the world is your own action. You cannot ever change another person. You can influence them, but you cannot change them. But people come to see me because they are mad at their coworkers. They don't like their boss. They just got a divorce. Somebody just died that was important to them. Or they are aging and they want to make up with their children. Like, it's really about how can we keep our connections with other people based in love, with good boundaries, because another form of poor boundaries, if there's fighting, is if people are overly connected, so enmeshed. And you don't want that either, because before you know it, like, the older member of the family is still taking care of their 40-year-old child. And, you really want people to get out and live their best life independently. Okay, fear. Okay, so fear, you can fear and be focused on the past. You cannot change the past, right? It's already happened. Those people get very depressed. They come in for treatment. You can fear the future. Guess what? The future has not happened yet. So that is a delusion to think that there is something out there that's going to hurt you. You have to be reasoned about it and ready to do the right thing in the present, because at the only time you can really affect a change is in the present. It may affect the future in a positive way or negative, and being present in the present may correct the past. So, because you can get humble with the problems from the past and be optimistic to help other people from your own things that might have not worked out well. And then faith, disorders of faith, like sometimes people say that's all the answer, and it's either I will never believe in a God, or I don't, believe in anything, or it's too much. Okay. So I'm going to go body, mind, spirit. This is pretty quick. Body well-being, it's things that Dr. Pho talked about. The number one thing is you need your sleep, you need to drink water, you need to eat healthy meals, exercise, decrease toxins. Don't drink too much, don't smoke, don't use a lot of drugs. But also decrease toxins for your body well-being might also be, do you have genetic variations in your body that do not allow you to get rid of toxins in a metabolic way such that you remain inflamed? And when you're inflamed, you have joint aches, but inflammation is also leads to depression and anxiety and things like that. And then appropriate medicines. So I say the right medicines, not the wrong medicines. So many people come to me, and I'm the psychiatrist, and I'm looking at their list of medicines, and I'm like, why are you on this? And many times people do not know. So we have to go over those things and then make appropriate referrals so that people are not on medicines that are hurting them. Okay. Okay, mind well-being. Okay, so these are the things that are actionable that are apart from medicines that I might prescribe. I prescribe a lot of medicine, but I like to not prescribe a lot of medicine. And I like to get people off the medicines I prescribe. That's not possible for everyone. There are many psychiatric conditions that I treat that require medicine, and they should not get off their medicines. But in general, that's what I try to move towards. The number one thing, in my opinion, that you can do is you can practice gratitude. I personally think you should practice gratitude in a written format because it gets it out of your brain onto a piece of paper and it makes it real. Okay, and it takes literally a couple of minutes. So it is something that can turn your day around in like just a moment's notice. I also like to pair that written list with writing down things that you cannot control. So you could think of it like blessings and burdens. When you write down the things that are bothering you, those fears and so forth, broken connections, financial worries, then you basically shut the book on it and you let it go for today. So it's just 24 hours. The next day, maybe you write the same things. But this is the way to begin to be truthful with yourself such that you can be actionable, like I said earlier. Avoid isolation. When people are depressed, anxious, or whatever, they stay to themselves. So it's important that when you recognize you're doing that you get out with friends, you call somebody, or maybe you just go walk in the park and say hello. Or when you're at the grocery store, you look through your full lens of your glasses and you say hello to who's checking you out. You connect with them. Okay, and then some of the other things that I can do that are not medicine related is I can order food sensitivity tests. When you're eating the wrong foods that you don't know your body doesn't like, you can get inflamed. Genetic tests for methylation. So this is how we detox bad things in our body. And these are pretty simple saliva tests to do, and they give you valuable information to direct what supplements you might need to be taking, because the vitamins in the grocery store are not always the best ones to take. That makes a dramatic difference in a lot of my patients with depression and anxiety when they are on the proper methylated vitamins. And then again, also appropriate medicines, not the right medicines, not the wrong medicines. Many people are on antidepressants that they don't need to be on, or they're on too many anxiety medicines and they're falling. I mean, so it's making sure that the medicines are streamlined. Spiritual well-being. So I typically will ask people, how do you nurture what you believe? So it's not saying, are you any particular religion? But it may be that question. And then you certainly need to make peace with whatever religion you don't have peace with so that you can move to a place where you feel comfortable. And then nurture what you believe, right? So are you kind? Be kind. Do you believe in saving your money? So save your money. Do you believe in helping others? Do you believe in volunteering? Do you believe in animals? You know, can you work at volunteer at an animal shelter? Prayer and meditation. Listen, the best prayer is, Lord have mercy. I say that every time I'm driving. Or, you know, help me, right? Help me is a good one. Yeah. And then meditation is just, you know, if I believe in goodness, let me think about goodness. Or read a meditation book that gives you something to think about for the day. Again, these things are better or as good as medicine. Okay, help others and volunteer, so that helps isolation, helps your community, makes connections, be part of a group. Again, you know, this is being part of a group. Be creative. That helps your spiritual well-being. I take piano lessons, I take art lessons, I take exercise lessons. I mean, like, I'd rather do all those things than sometimes work because they fulfill me, you know, and so you're never too old to learn something new. So it's important. And then be in nature, of course, you know, like breathe clean air, put your feet in the grass, go on a walk. I mean, and San Antonio has beautiful parks, so we can do that. Any questions? I did not talk about any antidepressants, but I can answer
I
those
got a
questions.
question for you and Dr. Pho. Is alcohol related to dementia?
100%, yes. So, like, there are studies that say, like, you can have a drink, right? So for a woman to be a moderate drinker, it's 4 to 7 drinks a week, okay? A lot of women have their glass of wine every day, or their big Yeti cups full of vodka. Okay, it's true. Okay, not a good idea, okay? For a man, you get 7 to 14 drinks a week to be a moderate drinker, okay? And some people can't metabolize it as well because they have these weird methylation genes. So I like people to take the supplement NAC. It's N-acetylcysteine. It helps your liver function more cleanly.
What was that? What was that?
NAC, N-acetylcysteine. Get it at, you know, the vitamin shop or ordered on Amazon. But so, yeah, like some people will say you can have a glass of red wine and that helps you, and that's probably true, but one, not two, right? But, you know, and then also, well, why, right? Why do I like 2 glasses of wine, but I really want 3? Is it because I'm unhappy because, you know, I'm a single parent, or because my kids are in college and now I've lost the meaning to my life? You know, and like you have to find new meaning for life, right?
So you're saying that even minimum alcohol is not, or moderate drinking alcohol is not really.
It's not healthy, you know, so it's worth examining, you know, and if there are no negative consequences, nobody's going to say that that's alcoholism, right? But does it affect your health, right? Like, is it affecting your health? And Dr. Pho will be glad to draw your labs and anyways. But do you want to add to what I just said?
No, not at all. I agree. I think it's a toxin. You know, it can affect your liver. You have to detox it. Excuse me. I have to say I don't know if it's because a bunch of alcoholics did the studies, but you know, the Mediterranean diet, they say, you know, drink wine, be happy with your family. I mean,
We're Mediterranean, we kind of go with that.
so I think there's a
But
fine
that's it.
line.
It's not, you don't go.
Yeah, there's a
It's
fine line between enjoying and celebrating and then, you know, heavy drinking. And
Yeah.
then what Dr. Mulroy said is correct. It's like, why is it that you're drinking 2, 3, a whole bottle or 2 or 3 bottles? That's actually medicating yourself with really
Right.
not drinking.
Great.
So, but I mean, it is, when you look at the structure of alcohol, you do have to get rid of it. Your liver works extra. And then when you're taking medications, that will really affect it. Yeah, so that's true.
The reason I ask because there's more and more articles mentioning about alcohol and dementia these days.
That's
It's
correct.
not happening in 5 years ago, 10 years ago. So I think research getting more and more deeply in the
That's a great point.
On that dementia, like alcohol to be metabolized uses a lot of B vitamins, and when you lower your B vitamins, you stop your thinking clearly. So, and then the other thing is alcohol is a great anxiety medicine. Not really. I mean,
Yeah.
it works, right? But then
Temporarily.
temporarily, it gets out of your
Makes you
system very
more
fast. When it gets out of your system
Yeah.
very fast, it's on a seesaw with another neurotransmitter called glutamate. Glutamate is very excitatory and very toxic to your cells, and so it bounces up when the GABA goes down that the alcohol stimulated. So then you get this rise in glutamate, and you get this toxic agitation to your body, which you'll see
Yep.
in the temperature of your body, your blood pressure, pulse, so forth. Yeah.
Puts you to sleep and wakes you up in 2 hours.
Yeah, and so then people come in, oh, doctor, I have insomnia, I need Ambien. It's like, well, Ambien's gonna make you eat and, you know, become demented. And so it's important to limit, you know, everything in moderation.
The Ambien's gonna make you
Ambien makes some people get up in the middle of the night. It turns your brain off completely, like you're in a blackout,
sleepwalking.
like you're in an alcoholic blackout, and it'll make people get up and they'll eat. They'll have crumbs in their
I've
bed.
never heard that.
Oh yeah.
That's interesting.
Crumbs in your bed. Probably not a good thing.
Okay, thanks for attention.
That was amazing. That was amazing. I was listening to that lecture and all the F's in there, and my goodness, so applicable. So, are you taking new patients, by the way?
Of course.
Okay, wonderful. We call them.
Private pay or.
Oh, I am private pay, yes.
There you go.
Because I spend a lot of time with my people.
Yeah.
And if you take insurance, you have to see a lot of people and throw medicines at them, and then you don't really see them and follow up very quickly. So that's
You're
been
right.
That's great. Thank you. All right, any other questions for Dr. Mulroy? Okay, so moving right along, our next speaker for tonight, Gretchen Peterson Dunlap with the Peterson Chiropractic. Gretchen has been an integral part of the office since 2003. She's the daughter of Dr. Ward and the sister of Dr. Tim Joshua, lots of nepotism there. So anyway, she's a passionate, very passionate about teaching and talking about all the amazing benefits of chiropractic. Gretchen is the director of community outreach and education. Outside of the office, she loves spending time on her ranch. She's a rancher with her husband Mitch and their goats, and chickens, and horses, maybe.
Used to be, but no.
All right, without further ado, let's welcome Ms. Gretchen.
Thank you very much. Thank you very much. Thank you guys for allowing me to be here with y'all tonight. I'm excited to see all your beautiful faces. So Peterson Chiropractic is my family chiropractic office. My dad opened his first practice back in 1985. So in April, we'll be 40 years old. We're pretty excited about that. Now, he's mostly retired out of the office at this point. He won't stop adjusting until the day he dies, but he's out of the office. And now my older brother, Dr. Tim Peterson, who's in the back there, is the main chiropractor of the office. Yes, hello, Tim. And then our younger brother, Joshua, runs the office operations. His wife works in there. And then I get the pleasure of getting out and doing the community outreach and education, which is why I get to be with you guys tonight. So that's a little bit about us. I figured since we were talking about health and wealth, that maybe we should talk about deposits and withdrawals. Okay, so we all know that the more deposits we put into our bank account and the less withdrawals we take out, the healthier the bank account is, right? But what if we start taking out too many withdrawals? We're going to end up with a sick bank account, right? So let's apply that same concept to our health, deposits and withdrawals in our health. So some examples of health withdrawals are things like being stressed out all the time and not taking a break, whether that's in work life, family life, whatever it is. Sometimes we need to just take a time out. It can look like we're working all the time, but we're not getting out and moving and exercising. That's been talked about a few times tonight. You know, we're going home and being a couch potato. That is a withdrawal on our health. Same as we're not preparing for what we're going to eat for the day. So we're grabbing junk food because we're in a hurry and we're hungry and whatever's closest to us. Doing that on occasion is good, or fine rather, but as a regular day in, day out, it's not going to be good for us. It's going to be a withdrawal on our health. And then some of us have bad going to sleep habits. We're scrolling on our phones, looking at social media, all these things that are keeping our brains engaged instead of letting that brain just quiet down, allow us to get a good night's sleep and have good dreams and get that restorative rest for our bodies. So those are examples of health withdrawals. Now here's some health deposits. It's basically opposite. Again, it's been already being talked about tonight. We've got eating healthier, at least healthier, exercising or at least moving more, staying hydrated or at least drinking more water, and getting adjusted or at least getting your spine checked. And depending on what we decide or what choices we make, we'll look like her or we won't, right? I'm going for that. So getting adjusted. Why is getting your spine adjusted a health deposit? It's all about communication. So the brain communicates with the entire body down the spinal cord, up and down all day long. So you can see where the nerves go. They go everywhere you can see and cannot see. And the brain is telling the body everything to do through that spinal cord. A chiropractor's whole job is to locate and correct what's called a subluxation. A subluxation is when a vertebrae gets out of alignment, it puts pressure on the nerve and it causes nerve interference. Now, wherever the brain is trying to tell wherever that nerve goes in the body, the communication is not going to be clear. Kind of similar to when you're on the cell phone and it's cutting in and out and you're not getting the full conversation. That's what's happening between the brain and wherever that subluxation is. So a chiropractor locates that, corrects it, and gets the information flowing freely again. Here's an example of a normal spine and a subluxated spine. So the normal spine, you've got the spinal cord running through the vertebrae, which is the bone that protects the spinal cord, with the disc in the middle, which allows us to have our flexibility and be able to move. You've got the muscles and ligaments to control our movements, and then there's that nerve exiting the spine, telling the body what to, where the brain's telling the body what to do. So when there's a subluxation, now that vertebrae is misaligned, which is going to create that, or cause that disc to swell because it's pushing on it, kind of like a balloon. It'll cause nerve interference, which is what we're talking about, that lack of communication. It causes inflamed joints, and muscles tend to tighten in response to that nerve interference. So sometimes people think, I need to go get a massage, I've got tight muscles. Sometimes that's the case, but if there's something deeper going on, that massage isn't going to help until you get that subluxation corrected, and then it can help. So sometimes it's out of order, okay? So we always want to go from here to here, and that's what a chiropractor does. So the why not? We've been doing this for a long time, 40 years. It kind of boils down to fear of getting cracked, fear of having to continue forever, or I'm not in pain, I don't need a chiropractor, I don't have headaches and backaches. So we're going to take a quick look at that. If this will go. Well, there we go. Okay, so in our office, we don't do snap, crackle, and pop. Our doctors use a technique called the torque release technique. They use this instrument to do the adjustments. So our patients just lay down, they get adjusted, it doesn't hurt, it's not scary, it's very effective, and it's very specific. I've got a video of my brother, Dr. Tim, doing an adjustment. You guys can see what it looks like. Give me a second here. Here we go. So that's an adjustment right there. He'll do one more. So as you can see, that's not scary at all. So if you've ever not gone to the chiropractor because you're scared, know that there's another option, okay? Now, will we have to go forever? So can we brush our teeth like once or twice and have a healthy mouth for life? Yeah, that's gross, right? We need to be doing it at least once or twice a day. I mean, at least once a day. Can we exercise for a year and then we're good for the rest? Like, we don't have to keep exercising. We got to keep up with it, right? What happens if we stop changing the oil in our car? I mean, yeah, it'll go for a while, but over time, it's going to totally break the car. So everything takes maintenance. It's the way God has designed everything. So do you have to go forever? It's always our choice what we do forever, but if our brain communicates with our whole body down our spine, it's probably a good idea to keep it in check, right? Okay, just gonna go in here. Okay, so I don't need a chiropractor. I don't have headaches. I don't have backaches. I'm fine. I don't feel it. What % of the nerves would you guys say feel pain? Just throw out some numbers.
All of them?
I've heard that. Yeah, all of them, right? Yeah. 10%. So 10% of the nerves feel pain. So if that's the case, what are the other 90% doing? They're about the functionality of our body. They're about my heart beating, my lungs breathing, my arms moving, me talking to you. It's all of that stuff. So even if you're not in pain, you don't have headaches and backaches, it's still a good idea to make sure everything else is functioning properly and get that spine checked. So out of everything I've talked about this evening, y'all can do most of that yourself. But you can adjust your own spine. And we don't do guesswork in our office. So if it was something you were interested in doing and getting a checkup, I don't want to leave you hanging. I want to give you an opportunity before I leave tonight. So when you come in for your first appointment in our office, I don't know what this thing, there we go. What it looks like is you come in, you'll have a consultation with one of our doctors. They'll do a full examination and any necessary x-rays in-house. And then they'll have you come back for a report of findings where they go over the results with you and they show you what they find and what they can or can't do for you. Now, normally that whole process is $315 in our office, but if anybody's interested in that, I would offer that for $97 as a discount just because we're here tonight, okay? So if anybody's interested, come let me know before I leave tonight. Otherwise, that is my brief presentation, and if you have any questions, I'm happy to answer them. So.
Any other questions? So I'm curious, do you do chiropractic adjustments for people that come in with mental health?
Do you guys do chiropractic adjustments for people who have come in with mental health problems? Have you seen patients?
Yes, it's not a direct treatment, like it would be something that, there's a patient that came in for all this pain, and then she realized, like 2 or 3 months into treatment, that the anxiety that she had all her life wasn't there anymore. So normalizing communication can oftentimes have these interesting side effects.
It's a good question. Thank you. Okay.
How do you have physical therapy also in your practice?
We do a couple of different therapies to help enhance the adjustment, but we don't do full physical therapy. We'll send people out for physical therapy if they need it.
Dr. Pho has physical therapy.
All right, there you go. Thank you, guys.
All right. So our next speaker is about money. Again, health and wealth, right? Financial professional and agency owner for over 11 years in the financial industry. Father of 4, devoted husband, and a man of faith. And he is also the president-elect of the Alamo Asian American Chamber of Commerce. There you go.
All right, thank you. I want to say thank you to everyone that stuck around. I'm at the tail end, and that brings a challenge because People tend to get tired after an hour and a half. But I do have a record I want to keep, and I need your help. No one has ever walked out of my presentation prematurely. So can you help me keep that record?
That's a good one.
People that learn and keep learning, they are smarter, they are wealthier, they are happier. And they want to learn more. Why is that? It's a habit. Learning is a habit, right? And that's why we are here at 8 p.m. on a Thursday evening. Jim Rohn, one of the most popular motivational speakers, he says, when he goes to do a seminar for people that want to improve their lives, it's not the people who are poor that attend, it's the people who are very wealthy that attend his seminar. Because they tend to want to learn more. And that is why we are here, and I appreciate you for sticking around. I won't take 2 hours, just about 10 minutes, okay? So hang with me. When Dr. Mulroy and Dr. Pho and Gretchen talks about all of these health benefits and health challenges, one of the biggest health challenge is financial health. And it ties to physical health because in America today, the biggest long-term stress is financial stress. And if you have long-term stress in your body, that hormone will break down your organs, and so it can manifest into physical health, and you have long-term financial difficulties. And so that's what we are here for. We have a company that educates people on financial literacy, and we help people to build financial foundation. That's what I'm going to talk about today. Let me ask you a question, very simple. If we want to build this house, where do we start first? The foundation. Do you see any builder that goes to build the walls and then the roof and then they forget about the foundation? They don't do that last. They build the foundation first. And the bigger the house, the taller the building, the bigger the foundation has to be, or deeper. And so in financial planning, we have to focus on building a financial foundation. Okay, and the financial foundation has 4 steps, and we start from the bottom up. Proper protection, debt management, let's get out of debt. How many of us believe there's good debt and there's bad debt? In our industry, we don't believe any debt is good. Let's get out of debt altogether because the interest that you pay into your debt can be the interest you earn on your investments. Okay? And then emergency fund. It's a problem in America today because people live paycheck to paycheck. They can't save for emergency. So we'll talk more about that, but that can be a problem, but we don't have that ready. And then investments. A lot of people, they are investors, but then they don't have the financial foundation in place. And so when the market turns, it becomes a challenge, a very difficult challenge for them to get through because none of the steps that they need to take before the investment part, they didn't take. Have you heard of investors who are asset rich and cash poor? They have a lot of assets, but they can't take money from it. And so that's not a good situation, okay? Like building a house, you must build it from the ground up. Let's talk about the first step, proper protection. And Dr. Pho talks a lot about longevity. We are all living longer, and so that's amazing. Right? And I think you're gonna go past 100. You look great. Living longer is a good thing, isn't it? But it comes with a challenge because the money challenge. We used to live to 75, 80, right? And then so we work all our lives to save for about 15 and 20 years of retirement. But then now we live to 95, to 100. So an extra 15 years of retirement, where does the money come from? And also, longevity brings health challenges. There's 3 things in life that are for sure. You will get sick, you will pass away, and you have to pay taxes. And so we have to protect against getting sick. We have to protect against passing away prematurely and left our family hanging in financial difficulties. And so protection is one of the key elements that we talk about in financial planning. Also, another Another protection that we talk about is long-term care protection. Dr. Pho talked, and also Dr. Moreau talked about Alzheimer's and different conditions that can come into your life and pose a health challenge, also a financial challenge. A lot of people right now are not prepared for long-term care condition, and the statistic is, it's very scary. 70% of people who are over 65 will fall into long-term care condition. Alzheimer's is the leading condition that will cause that. And long-term care is very expensive, and Medicare doesn't pay for it, and health insurance doesn't pay for it. So we have to protect against that. The cost of long-term care in today's world is about $10,000 per month. $10,000 per month. If we're not protected, we don't have protection in place, where is the $10,000 coming from? We have to protect against that, okay? Next thing is debt management. Can we all work on getting out of debt? Because being debt-free is a wonderful thing. You know, we grew up not being in debt. In my country, in Vietnam, most people don't have credit card debt. Most people don't have bank mortgages. Why? Because they buy everything cash. If you can save it and you can buy it, you go and buy cash. So they will carry a suitcase of money to buy stuff, right? But in America, everything is credit card and credit. So most of us who are younger and we're still building our wealth, we don't own a home. We own a mortgage. The bank owns the home. And so we get into this situation where we have to work to pay our debt all our lives. And we advise people, let's get our debt early so that we can start enjoying life and building wealth even more. We use something called a debt roll-up to get out of debt completely. This is one of the very effective programs that we use for people who come to us with a lot of debt, and it doesn't take much. Just yes, debt-free and wealthy is associated with oxytocin.
Absolutely.
Which is the happy hormone, right?
Yeah.
The love hormone.
I love it. Love it.
When you have money and you're out of debt and you know you have a good financial future, you tend to be more happy.
Mm-hmm.
It affects you. Emergency fund, we advise people to build up 3 to 6 months of income for the rainy day. And the rainy day will always come. And so if we don't have the emergency fund, what happens? We have to withdraw early retirement. We have to sell our investments. Long-term investments, that's not a good deal. And so we gotta have an emergency fund so that we can protect our investments. Okay? Last thing is investments. Investing has different options and strategies that we need to look into. A lot of people, when we hear the word investment, what do you immediately think about? Investment. Stocks? What else? Real estate? What else?
Crypto.
All of these shiny objects we call investments, right? But it takes a good amount of strategy and it takes knowledge to get this done and build a great portfolio for your family. I won't go into these numbers, but I want to show you this right here. The importance of understanding your taxes when you invest in your money. There are 3 buckets to strategize for taxes. How many of us like to pay taxes? How many of us pay a lot of taxes?
We all do.
Well, congratulations, because you're very wealthy. That's why you pay more taxes than other people, right?
Yes, that's true.
The people who are not paying a lot of taxes, that means they don't make a lot of money. So be happy. But can we eliminate some taxes in our financial plan? Yes, we can. Yes, we can. Okay. Tax now strategies are your checking accounts, your stocks, mutual funds, your real estate. You buy real estate now, later on when you sell it, you earn anything from that, you have to pay another tax called capital gains tax, 15 to 20%, okay? Tax later is your pension, your 401k, your IRA. These, you're not being taxed now, but later when you retire, they will tax you at the later rate. Okay? Who's they? The IRS. How about tax advantage? It's not tax-free. You have to pay income tax, and then you use the after-tax money, invest in different places like life insurance, health savings account, Roth IRA, muni bonds. You earn anything from these accounts, you don't have to pay capital gains tax. Can you eliminate capital gains tax? Absolutely. And a tax strategy. So a lot of people, if they don't know the tax advantage options and they dive into all taxables, they end up paying a lot of taxes at the end of the year. Okay? We talked a lot about longevity planning. And let's plan to live longer, and that takes a lot more money. Every year that we live means that we're not working, means that we need to take money from somewhere to live on. And so we plan for longevity as well. We plan for people to live longer, and we have programs that help people to build up their pension so that no matter how long they live, they still have money coming in. Okay, those are great programs. So, moving from financial insecurity to financial security to financial independence. That's what we do. That's what we help people with. And I have some brochures in the back if you want to take a look at some retirement plans. We do these educations all across the country. And so if you have a community that wants us to go in and teach these concepts, we would love to come and teach. And that's my part for tonight. Any questions for me in terms of money? Part of being well-being or being well is have good finances. So add another F to your list.
How do you keep from paying all this tax?
Well, you strategize with all the tax advantage accounts. You know, the very wealthy people, the ultra wealthy, they pay the least taxes.
Because they have a good financial advisor.
Right, there you go.
Sometimes it's not the money you make, but it's the money you don't pay taxes. Am I right?
The money you keep.
Money you keep. It's not the money you make, it's the money you keep. And
That makes
not pay
sense.
taxes.
Yep.
Anyway, so, did you learn anything? Yeah. Okay, if not, we've got lots of resources out there. We have your sponsor for today. I don't know if you have time to.
I think they may have,
They
they had to.
Anyway, so, any last minute, questions? Sleep is important, so. Go home and sleep, but we have lots of food downstairs still, so please, and they're healthy. Fruits, meat,
Yeah,
protein.
some of it. There's some salami that might.
And wine.
All right, so I want to thank everybody. Let's see, we're on YouTube, you know. I think I was moving around so much.
I think all the speakers should stay in front of you.
Yes, yes,
And everybody take a picture.
absolutely, absolutely. So we're in the blue zone. We're in the blue zone. Okay. I'm so happy, so thankful everybody came today. You guys learned all the secrets. This is on YouTube. We got Dr. Amy Mulroy. We got Zui, the legend of financial. We got Gretchen back there with Peterson Chiropractor and yours truly. We talked about health, what it means. The definition of health is not just physical health, what I do. Not just but we do a great job. A great physical examination, looking at your genes, trying to motivate you to do the things that you can change what happens with the expression of your genes, called epigenetics. And a lot of it may be the best part of your body, which is above your neck. That's your brain. We heard Dr. Amy Mulroy talk about the motivations of your brain. The big F's. Too much fun, sex, alcohol, and drugs. All the bad stuff. Fear, terrible. And it does, if you think about it tonight when you go home, it does motivate you perhaps to do the wrong things. And we want you to do the right things. And then, yes, we need natural therapy with chiropractor, with physical therapy. I believe in all of this. I'm a big fan. If you go to a surgeon, they're going to cut on you. If you go to a barber, they're going to cut your hair, even mine. So, you know, it's enough. We need natural treatments. I love it. Physical therapy, chiropractor. And then, yes, when you're living longer, you know, money doesn't make you happy, but it can help. And you're going to need it. And what we heard from Zui tonight, Legends Financial, is wonderful. It's just independence from all of this, and it just helps you carry through with life. To my wonderful patients here to 100 and beyond. I'm telling you, my goals are for you to live to 100, but I'm changing that now. I think 110, 120. Now, I have to end with this because you're going to need some help. If you get that old, come see us. We're going to make you look younger, like at 60, 70, 50, whatever. All right, I want everybody to come up here. I want to thank everybody. Round of applause. The speaker, Dr. Monroy, come on up here. All right.
Fall.
Don't fall. F is not for fall. I want to thank Melinda, Dr. Melinda Rodriguez. She is at University Hospital. She has won all of the awards. She's wonderful. I want to thank Gretchen. She's wonderful. Here, let's see here. Are we on this? Yeah, let's see if we're on there. Okay, come over here. Everybody here. We're on YouTube. All right, we got Dr. Mulrow to my left, and to her left is Zui Lei, the legend. We have the legend. We have the goddess. We have the second goddess. We have another goddess, and I'm the king. Thank you, everybody. Thank you so much.
Do a selfie with everybody. Everybody stay put for
All right, everybody come up here. We want all the audience to come up here, have a big picture.
No, not them sit there, you guys.
Oh, okay, great. Yeah, that's you got it. All right, sorry about this.
Come closer, come together. Yeah.
So everybody that's here that signed up, 20% off of all my aesthetic treatments, including the sexual treatments. 25%, 50, whatever. I want to make you happy.